You're listening to Health Innovators, a podcast and video show about the leaders, influencers, and early adopters who are shaping the future of healthcare. I'm your host, Dr. Roxy Mooney. Welcome back to the show, Health Innovators. On today's episode, I have a very, very special guest, Mauro Guillen. He is the author of 2030, How the Biggest Trends Are Going to Collide and Shape the Future of Everything. Welcome to the show, Mauro.
Oh, Roxy, thank you so much for inviting me. It's a pleasure to be here.
It's so good to have you here. So I wanted to start off the conversation with just a little bit of your background and what prompted you to even write this book.
So I am originally from Spain. That's where my accent is from. I lived in the United States for 25 years. And just 6 months ago, I moved to the UK to be the dean at Cambridge Judge Business School. And I was trained as a sociologist and as an economist. And, maybe about 6 or 7 years ago, I started to do quite a few presentations about what was going on in the world as part of my job. And I detected that my audiences were getting very, very concerned about the future. And so I decided to write this book as a roadmap, as a way for people to understand what are the key trends and what are some of the really important things that they need to take into account if they want to be effective and successful in the future.
Yeah. That's great. And we're so appreciative that you took the time to write this book, because it really is an incredible roadmap for every leader, every entrepreneur around the world, not even, just in the United States or not even just in healthcare. Certainly, this show is the Health Innovators Show, where we're really focused on healthcare. So a lot of the questions that I'll ask today will be within that context. So I wanted to kind of start off with, what are some of the big trends that are affecting healthcare or are going to continue to affect healthcare from now until 2030?
Well, several of those trends have to do precisely with some of the successes that medicine and better hygiene and public health measures have had over the last, let's say, 50 or 60 years. So one big challenge, of course, will be that beginning with Japan and then China, Europe, and the United States, we're going to have 40% of the population above the age of 60. And as you know, chronic conditions are more frequent in that age group. And of course, 80% of healthcare spending, or up to 80% of healthcare spending, has to do with chronic conditions. So this is something that I think is going to be very, very consequential. The other big trend that I would mention is technological change. And of course, medicine has always been a fertile ground for new innovations using technology, MRI machines, and all the rest. But in addition to that, now we have, I think, this amazing trend of telemedicine that we weren't really using that much in Europe or the United States. But if you remember, in Sub-Saharan Africa, they've been using for 10 years. But of course, the pandemic forced us to experiment with remote work, with remote shopping, with remote learning, and also with medicine at a distance, with healthcare at a distance. So I would probably say those are the two biggest trends.
So, I think you make such a valid point. We've had a lot of conversations about how COVID has accelerated a lot of adoption. The healthcare ecosystem is, so entrenched with a lot of the old ways of working. And, telemedicine is not new. It's been around for 25 years. And, we've all had these, players in the marketplace that were saying we couldn't do it for a variety of reasons. And then we were kind of forced into it. And all of a sudden, we can do it. We've proven to ourselves that we can. How do you think that the COVID has accelerated some of the trends that you've talked about in your book? I wondered, after reading that through COVID, is it really going to be like 2027 now instead of 2030?
Exactly. I always joke that the title of the book now should be 2027 or 2028, because the future that I describe in it is now arriving faster.
Yeah.
Look, COVID has, for the most part, accelerated everything. It has accelerated population aging. And some people find this counterintuitive, but it's actually very straightforward. Young couples have postponed having children during the pandemic, right? Because of the uncertainty, because maybe they lost their jobs. So in the United States, maybe about 300,000 fewer babies than expected were born in the year 2020. We're still waiting for the numbers for 2021. And so this is, in other words, then accelerating population aging, right? If people postpone having babies. Another thing that has gotten accelerated, unfortunately, is economic inequality. And I think this also has an impact on healthcare in terms of access, in terms of to what extent people are willing to go to the doctor to take care of themselves on time before their health condition deteriorates. So that is also something that has been accelerated by the pandemic. And then the last thing, of course, is technological adoption. This is the most obvious example. And let me just add one thing you said earlier about the healthcare sector. You see, the big advantage that we have now is not only that we have platforms such as the one that we're using now, but also that the healthcare sector over the last 20 years has gone through this process of digitizing records, right? I still remember when you would go to the doctor and the doctor would actually get an X-ray on film, right? Yeah. But then if you switch doctors, if you switched residences, you moved to some other part of the country, you would need to bring your X-rays with you. Whereas now they're all digitized, so any doctor, any nurse, anybody can access your record from wherever in the world.
And it would take you weeks to get those, and you had to go and drive and pick them up.
Exactly right. So I think the digitization of medical records is something that will greatly facilitate this new wave of telemedicine that we're going through.
So you touched on so many different things that I want to dig deeper into, but I know we have a finite amount of time here. So I'm going to try to be really specific and targeted with my questions. There are so many companies out there right now in healthcare, those industry dinosaurs or incumbents, and you've got a lot of mid-market companies as well. I won't spend too much time on the early stage companies because I think for the most part, those folks are already seeing what you kind of put out and it mapped out in the book, and kind of already starting companies to leverage those trends. Focusing on the mid-market companies and maybe some of the longer, more established corporate companies, are you starting to see an uptick in them kind of recognizing that need for growth through innovation and capitalizing on those trends? Or are we a little bit slower in making that happen?
So I certainly see a lot of innovation, a lot of new initiatives among smaller to mid-sized companies in healthcare. For example, when it comes to population aging, as you know, there's a whole bunch of investors and entrepreneurs who have jumped on this, trend of providing, for example, living space for people above a certain age, living space that is specifically designed for their needs and for their preferences. And I see also in certain areas of technology, just let me give you two very quick examples. One is 3D printing, how we're starting to use in medical applications for tissue transplants, for dental pieces, and so on and so forth, 3D printing. And of course, we're starting to see this as well for therapies in other fields, using other fields of technology, such as, for example, virtual reality and enhanced reality, and now perhaps in the near future, the metaverse. So in many different kinds of areas in healthcare, I see a lot of innovation, a lot of entrepreneurship.
Yeah, absolutely. So what are some of the tips or tricks that these leaders need to be mindful of as they are kind of observing these trends and want to be able to figure out how they can best take advantage of them? I think you give a couple of examples in your book. Lego and Philips are, I think, really great examples, if you don't mind sharing those with our audience.
Well, Lego is this Danish toy company, the building blocks. As you know, traditional toy companies have been wiped out by video games and by other alternative, more tech-enabled kinds of games, even for very small children. But they have not only survived, they have thrived, and every year they increase their sales. And that's because they reposition themselves to become a multi-generational company. So involving children in the games, but not only children, also their parents, grandparents, and so on and so forth. And they continue to innovate like crazy in terms of launching new designs and capturing the imagination of people, right? Philips, the Dutch company in this case, they made a ton of money 100 years ago with the incandescent bulb, the electric bulb. GE in the US also made a ton of money out of that. But these days, you cannot make much money with that because it's a commodity. Prices are very low. They also went through a phase of making TVs and making video recorders, also commodities these days. They realized, look, the world is changing, population is aging. Our advantage is research and development. So why not focus on healthcare? And Philips is, as you know, one of the top 4 companies in the world for MRIs and other related equipment. And they are now deriving 70% of their sales and more than that in terms of profits from healthcare. So they examined the landscape and they decided, let's switch gears. What we were doing in the past is no good. We need to align ourselves with these trends. I like to use the metaphor of the surfer, right? So I think what you need to do when so many things are changing is be like a surfer, catch the biggest wave you can imagine.
So those are great examples. And so help us understand, what is the difference between those companies or those leaders of, let's say, Lego and Philips versus a Blockbuster and Kodak, who took very different paths?
Yeah, absolutely. Kodak is a company. It took a very long time for Kodak to go bankrupt finally, but it did. Mm-hmm. But it took like 20 years and they didn't see it coming, right? Really. How the world of photography was changing. But look, at Lego and Philips, what happened was that they went through several CEOs. Mm-hmm. And each of those CEOs, lasted for no more than 2 or 3 years. And they essentially didn't want to change the company, didn't want to realign it with those, big trends out there. Mm-hmm. So they persisted at the old recipe, the way in which they had been making money for a long time. And the reason why those CEOs lasted only 2 or 3 years on average is that, that wasn't enough. It wasn't enough to cut costs. You needed a fundamental realignment of the company, given what was going on in the world at the time. And so most of the time, companies manage that realignment when they bring in somebody from the outside who has a fresh perspective. It's not always the case, but it's frequently the case that more often than not, that an outsider is the only person who is really in a position to turn things around.
That's such a great point. And when you think about healthcare, it's such a risk-averse industry. And I think a lot of times the perception is that when they look at all of these big trends, making these investments, making these leaps, this diversification, these big moves seem to be perceived as really high-risk moves. And sometimes I think we overlook the fact that maybe there's a greater risk of staying with the status quo than leveraging the big trends that you talk about in your book.
No, absolutely. I mean, again, Kodak. But, talking about risk-averse industries, I come from the most risk-averse industry of all, which is education. Okay, if you think healthcare scores high on that, education is surely the winner in that contest. So I think what is really, really important is to understand that right now, not only just one thing is changing. We have so many things changing: population trends, economic trends, technology, society, the balance of geopolitical power. Everything is changing all at once. And so, incremental adaptations, I think, are most of the time not going to be enough. So you have to go one step beyond that. Now, I'm not claiming here that every company should reinvent itself inside out, from top to bottom. That's not what I'm arguing. Okay. But, there is, I think, a happy medium between just incremental change at one end and wholesale transformation of the entire company at the other. So depending on, which company, which organization we're talking about, they may want to strike the balance at a different point, but I would avoid the two extremes.
That's a really good point. A really good point. Hey, it's Dr. Roxy here with a quick break from the conversation. Are you trying to figure out what moves you need to make to survive and thrive in the new COVID economy? I want every health innovator to find their most viable and profitable pivot strategy, which is why I created the COVID Proof Your Business Pivot Kit. The Pivot Kit is a step-by-step framework that helps you find your best pivot strategy. It walks you through 6 categories you need to examine for a 360-degree view of your business. I call them the 6 critical pivot lenses. As you make your way through this comprehensive kit, you'll be armed with the tools, tips, and strategies you need to make sure you can pivot with speed without missing out on critical details and opportunities. Learn more at legacy-dna.com/kit. So I want to go back to a phrase that you use in your book called "Gray is the New Black." And we've touched on it a little bit, with the increase in the population of 60 plus. There's so many ramifications of that in healthcare, right? You talked about chronic disease and the need for more. Sometimes there's a perception that this 60 plus generation or population isn't so technologically savvy, and they're not using the iPad. They're not necessarily wanting to text with their vendors that they're working with or healthcare providers. So talk a little bit about maybe some of the myths and misconceptions that we have on the attributes of this gray population.
Yeah, so myth number one is that it is a small segment. And of course, it's not, because numerically it's becoming really big and it will be the largest. Myth number two is that they have no purchasing power. Look, in the United States, 80% of the net worth is in the hands of people above the age of 60, 80% of the net worth. Which, by the way, also triggers another issue, which is inequality, right? I mean, that net worth is not evenly distributed. And that's, I think, an important consideration for healthcare organizations. A third myth is this lack of familiarity with technology. Now, this will be, even if it's true, or if it were true, the problem will be taken care of as time goes by, right? Because now we're seeing baby boomers going into retirement, turning 65, 70, 75. And of course, many of them have used IT at work. So they are capable of using phones and iPads. And look, the pandemic has also invited many people who were reluctant to use technology, right? So the pandemic, I think, also marks a before and then after. And then the last myth, which I think is something that we need to carefully examine in terms of its implications, is that people above the age of 60 have a different lifestyle than people below the age of 60. This has changed because, as you know, it's not only that the lifespan has increased, that we live longer. It's also that the health span has increased, meaning that a 60-year-old, a 65-year-old, a 75-year-old today has a much more active lifestyle than somebody of the same age 2 generations ago or 3 generations ago. So that's also something that is a myth, that these people are different. No, they're not. A 70-year-old today can, have a lifestyle that is as active or even, more active than that of a 50-year-old. So I think we need to change our mindset about some of these, inherited stereotypes from the past.
Yeah, absolutely. So you said something about purchasing power, and I want to shift the conversation a little bit from the gray market to women and the shift in wealth to women and the shift in buying decisions. So, at least 10 years ago, I remember coming across statistics that showed that over 80% of buying decisions were made by women, whether they were the ones that even in single family income homes, still a lot of the purchasing decisions were being made by women, even if they didn't have a job. Now you're seeing that kind of maybe amplified with the shift in wealth for women. So talk about some of those trends, and then how do you think that affects healthcare?
Well, women's economic progress in the labor market, in terms of their professional careers and all of that, it has been remarkable, especially in the United States, but also in other countries around the world. This is not to say, of course, that discrimination doesn't exist based on gender. Of course, there is discrimination. Progress has been phenomenal. Just before the pandemic, the U.S. Census Bureau reported that in 39% of American households with a man and a woman, the woman made more money than the man. Okay. Now, the pandemic, as you know, for the most part, has been a setback for women, right? Because of, the unequal distribution of tasks in the household, and many women withdrew from their jobs. They quit their jobs as a result of having their children not at school, but rather at home. But I think that progress will resume now. And by the year 2030, the U.S. government itself predicts that in more than half of American households, women are going to be making more money than the man in that household, right? Now, that's remarkable. Right. When you and I were
it's
born,
so much progress.
when you and I were born, that wasn't the reality out there. Right. I mean, the world has changed, especially in terms of the role that women play in the society and in the economy. So this will have major ramifications. And you know what? There's something really important for healthcare. As women have more money in their pockets, there's three categories of spending that go up for households, because they spend that money not just on themselves, but also on their children, their grandchildren, maybe their grandparents. One is education. So women are more likely to spend more money on education if they have that money available. Another one is insurance. They prefer more comprehensive insurance. And the third one is healthcare. So women are more inclined. This is true not just in the United States. It's true in every country in the world. So if women are, as you said, not just decision makers, but also they're the earners or the main earners of households. And by the year 2030, we could be in a situation in which in more than half of American households, that's the case. Then I think that is good news for insurance. That is good news for education. So my industry. That is also, I think, very good news for healthcare, because women care more about the future. That is a unifying theme. When you think about education, insurance, and healthcare, it's all about the future. Mm-hmm. Women place a bigger premium on the future than men, right? Mm-hmm. And of course, in the healthcare sector, this is really important because prevention is everything, right? We want to prevent things. We want people to go to the doctor. We want people to have health insurance. And women are more likely to do that. And hopefully they can, in this new position that they have now, they have more tools, instruments at their disposal, in addition to more money, more persuasiveness maybe, so that other members of the household also take care of themselves better.
You know, and I think to that point, there's this huge gap between in women's health. So if you look at statistically the investments that's made in healthcare, a lot of women's health issues have been overlooked. And so I think what you're talking about, where their higher earning power with women and higher purchasing decisions, means there might be more investment pouring into femtech. And then also you'll seeing more diversity. So a lot of the clinical trials, a lot of the piloting that's done is really with white men predominantly. Yeah. You don't see a lot of minority populations and you don't see a lot of females involved in that. So I also think that as women have more of that purchasing power and wealth, that you'll also start to see maybe even just the healthcare landscape start to shift because of that.
Oh, absolutely. I entirely agree with everything that you said. But I must add that all of that is on the one hand. But on the other, there's also some hazards that women are experiencing because now they work outside of the household in greater numbers, mm-hmm. and they have more responsibilities. But at the same time, as I was mentioning earlier, they continue to take on more than 50% of the tasks at home, right?
So for some reason, we think we can do it all and more.
Yeah, but the problem, as you know, is that and this is very well documented in epidemiological studies, is that levels of stress among working women have been going through the roof. And stress, of course, is a condition that makes you more likely to experience other chronic conditions. In addition to more exposure to stress, women who work outside the household, they're increasingly also drinking more. They're more likely to use drugs, unfortunately, and also smoking. So we have to keep an eye on it. What I'm saying is that there are many benefits to this. There are many great things that are happening, but at the same time, also there are some hazards that are affecting women to a greater extent than in the past, and we need to pay attention to them.
I think that's such a great point because alcohol consumption statistics have increased significantly since the pandemic, and women are a big part of that increase that's happening. I think the solution to this, and I'm kind of being a little facetious here, but also kind of just hoping that it comes to fruition, is you talk a lot about robots being able, and it makes me think of the Jetsons, right? And who doesn't want a Rosie in their life? And so part of that can help women and men mitigate some of the stress that we're experiencing is to be able to have some of these robots like Rosie in the house to help us share some of that workload.
Well, look, I am a fan of the robot that cleans the floor, because I used to have a vacuum cleaner, and it's just so nice to be able to tell the robot, just clean this room or clean the whole house. Look, home robotics is going to be huge in the near future. We're only seeing the beginnings of this. And by the way, I think this is something that will be of great benefit to people above the age of 80, of 90. because they're going to be able to stay in their home much longer if they can use some of these robotics or some of the household tasks, for lifting heavy weights, like the shopping bag, for doing this and that. So I think home robotics, it's going to be big, and it's going to particularly, I think, be beneficial to people above a certain age when they can no longer, undertake or perform all of the different tasks by themselves.
Yes. Yeah, absolutely. So the last trend that I want to talk about as we start to wrap up here is the trends of Asia and population growth there, as well as Africa. When I'm talking to health innovators, there's a lot of conversation about trying to enter into the U.S. market. And this is not everybody's experience, but it is a common experience that I hear is, I've struggled for years trying to penetrate the U.S. market. And there's just so many barriers. And I'm actually having more success going outside of the US, maybe penetrating the Asian market first, or even some of the markets in Europe, and then being able to take those cases, that clinical evidence, and then be able to come back and have more success in the US market. How do some of the trends that you talk about in your book potentially affect healthcare on a global level?
Yeah. So I think what's important is to take another step before you think about geography, which is which segment of the market are you targeting, especially by age? Because you see, in the world, we have markets that are aging very, very quickly, like Japan, China, Europe, a little bit the United States, but others that are still very young, like India, like Sub-Saharan Africa, like the Middle East. So first, I think you need to figure out as a company, your products or your future products, which segment you want to target. Maybe you want to target all of them. And then C, the second step is the geography, which parts of the world you see that segment growing the fastest, and therefore then you should be perhaps going there. So if you target the population above the age of 60 or 70, that's growing in the United States as much as it is growing in China. Japan, of course, is in a class in and of itself, but right. in that regard. So I would take one preliminary step, especially when it comes to services for people like healthcare, right? So I would say the same thing about financial services. I would say the same thing about education, which is first segment the market. So by age, by income level, all of those things. And then take a look. The second step is the one that you suggested. Take a look at in which geographies in the world that segment is growing the fastest. And that should give you a clue as to how you should prioritize your investments and your marketing budget for different parts of the world.
Awesome. So last question for you as we wrap up here. What advice or guidance do you have for the healthcare leaders that are listening to this show? How do they leverage the opportunities that are kind of nested in your book and in the big trends that you talk about?
Yeah, so I would make three very, very simple points. The first one is, yes, there's a lot of things changing. There's quite a few challenges and threats ahead. But be optimistic. There's also opportunities embedded in these huge transformations that we're going through. Point number two, the only possible response to all of these changes is change itself. If you remain static as an organization, most likely you will not be better off in the near future. You're going to be worse off. So change is the only possible response to change. And then number three, when you see that all of these things are changing, make decisions, but never make decisions that are irreversible. Always keep your options open. Cross the threshold, but leave the door open just in case you may, need to go back to the other room. So never make decisions that lock you in, that don't give you the opportunity to correct course in the future. I always say this, whenever you're making an important investment, whenever you're making an important decision these days, always think, right, before you actually commit to it, as to how you can make a modification, how you can, correct course in real time. Don't lock yourself into a path of action. Don't run yourself into a corner.
I think that's so important that I just want to emphasize that, because so many times we think we analyze these strategies, we identify our target audience, how we're going to position our products and solutions going forward, and we've got a strategy and plan, and then we get so stubborn with that the market is talking to us when we start to execute and enter the market in the real world, and sometimes we just ignore that, or we see that as a sense of failure instead of a sense of that's part of the process, this iteration that you're talking about.
Absolutely. I think it's so much better to arrive at where you want to go under changing circumstances by taking small steps, right? Mm-hmm. So you know where you want to go, but you want to preserve this freedom, these degrees of freedom, so that you can, change direction slightly here or there, depending on how the circumstances evolve.
Awesome. Well, thank you so much for sharing your wisdom and insights with our audience today. It's been really invaluable.
Oh, thank you so much, Roxy, for inviting me.
So if anyone wants to follow up with you after, how will they follow you or connect with you?
Well, the best is LinkedIn. So please connect with me on LinkedIn. I frequently post on that network, and that way we can also communicate.
Awesome. All right. Well, thank you so much for joining me today. Thank you so much for listening. I know you're busy working to bring your life-changing innovation to market, and I value your time and attention. To get the latest episodes on your mobile device automatically, subscribe to the show on your favorite podcast app like Apple Podcasts, Spotify, and Stitcher. Thank you for listening, and I appreciate everyone who shared the show with friends and colleagues. See you on the next episode of Health Innovators.